our session moderator, Dr. Ben Chislagi. And Ben is a scholar and a thought leader who works at the intersection of ethics, gender equality, and social justice in collaboration with a wide range of NGOs, UN organizations, and universities. He's currently co-leading the Humanizing Development Collective. And so I'm going to turn it over to Ben, who will introduce our other esteemed panelists and guide us through the rest of our session, and also give some thoughts of his own on this topic because he has a lot of them. So thank you, Ben. Over to you.
Thank you. I don't know whether that means that I'm very opinionated or so I apologize first of all. Thank you for the introduction. A funny story is that my hair appointment fell through, so you see me with this crazy hair, which is obviously a great lesson in how funny our ego is that's the first thing that I'm interested in telling people, right? Oh, I'm sorry about my hair. But I guess there is some attachment in how you see me and perceive me, which is actually very interesting and I'm sure will come through in our panel. Okay, so first of all, maybe before I start to give you my own thoughts and I introduce our participants for the panel today, I would like to ask everyone who's in this meeting, if you could respond in the chat to this first initial introductory question. And my first question is, where does your interest in the topics of ethics and scaling up come from? And what do you see as being the most critical issue? In that way, we will, after the panelists have presented, we will select and try to address all the questions, of course, depending on the number, but we will try to address the questions that and present our participants with the questions that you have shared in the chat. So while the last few of you contribute to the question through the chat, and thank you very much for those who have, maybe we could start giving a little bit of an understanding of why we're doing this panel in the first place. And it's funny how in a way this is a space and time in which we ask our question how we should live our life, right? What is precious in life? We tend to work and as we enter the field of global health and international development, we tend to work within these pre-existing structures and paradigms and dogmas, and it's very hard to challenge them. And when we look at the existing how global health is framed, I would like to suggest maybe 4 initial points of view that can help us understand why are we talking about ethics in the first place. Some of you might say, well, global health is beautiful and perfect. It's probably the most beautiful thing that our civilization has accomplished. Please don't touch it. Others of you instead, as those who have answered in the chat, might not share that concern. And I am in the latter group. I do share the concern that global health and international development, as the two obviously go very well together, are in need of a little bit of a pause and reflection at different levels of the ecological frame, the ecological structure that creates the relations of power that affect global health. And I have 4 small metaphors to kind of highlight 4 of the many ethical conundra that exist in global health. The first one is that I feel that global health is often structured as a supermarket. In the supermarket, in the same way you go to the supermarket and, you know, there is someone who's selling you cheese and meat or whatever you eat. If you're a vegan, none of these options apply to you, but you go to the supermarket and buy something. Well, global health is structured like that. The goal of global health is the way in which global health is operated is how do I get to grab that product? How do I invest? How do I inject money in a way that generates an output? And who do I need to pay to get there, right? So if I'm a CEO and I want to increase sale of computers, well, who do I need to to pay? What do I need to make happen so that more people will buy my computers? And so eventually, what I'm interested in the end is the increase in sales of computers. Global health is structured in a very similar way. We're not obviously going after selling computers, but we're going after adopting vaccines and practices that on paper are obviously very positive. But then instead of working for the people through the money, the structure and the system of incentives that operates in a very capitalist world in which we all feel unsafe. I'm in America right now, where if you don't have a job, you don't have a health insurance. In that way, then the compromise is I will sell to you an outcome so that I can finance the survival of my institution and my own position. So how an outcome-based industry versus a process-based? I give you money to achieve, to put in place a process rather than to achieve something. How does that influence? That's something that our panelists will talk about. How does that influence the whole system? That's the first metaphor. Global health as a supermarket. The second metaphor is global health as a boxing ring. Because of the delusion that we can achieve sustainable change within a short amount of in behavior, which in a short amount of time, in any situation and occasion, and in certain situations and occasions, it is possible. But because of the belief that we can achieve that, then when a proposal gets on the market, and that's why I'm talking about a boxing ring, when a proposal, when money gets on the market, then there is just a competition of who can do it with the least money and with the most expansive reach. So that all of a sudden we say, well, we will change. We compromise, for instance, intensive interventions that only address one small location in favor of very diluted intervention that work at the national level, because that will provide a better name and view for the intervention itself. So that run to the cheapest intervention in the shortest amount possible, clearly is beneficial for getting greater finances, because I'll say, yeah, I'll change, I'll eradicate, or I'll do a national campaign, I'll do a national work on using condoms in Nigeria with $100,000. But of course, if you've ever had done any global health work, you know that is not possible, right? So then really that system of incentives pushes interveners to compete and market for the attribution of results, and in a way that threatens slow-paced, people-led, principle-based sustainable programs and solutions. My third metaphor, after the supermarket and the boxing ring, is the colony. Global health is a colony. Despite a lot of attention being given on how do we not superimpose norms and values offer on the non-Western world, truth of the matter is that those who work in global health, and probably most of us who are here today, either are coming from the Western world or the so-called global North, or have been acculturated, educated, socialized in a global system of values that come from the global North. So I remember my colleagues from Senegal. I lived 7 years in Senegal. Many of my colleagues said, what happens in my family, I could never use those frames of reference in my office. So on the one hand, they will be pushing interventions that would give, say, for instance, exclusive breastfeeding, and then at home agree with the mother, the grandmother, that the child should also have some water. So this is why we talk about global health as a colony. You're allowed to play in global health only if you perform or are deeply convinced of the values that emerge from the most powerful parts of those who are in power, those who have most of the power. And finally, as I move closer to my presentation of the panelists, this fourth metaphor is global health as a juggernaut. Of course, you know what the juggernaut is this mythological beast, a machine that grinds and eats everything that it meets, that nothing can stop. And global health and international development work from one intervention to the other. And as soon as you have evaluated, you're lucky if you have time for an evaluation, because you need to run after the next log frame. You need to run after the next proposal. What's the next big thing that I can go and present at a conference? And then I will get on stage of a conference. I will have 10 minutes. Everyone will clap, and then please move on, because there is someone else now that needs to showcase the results. And where do we actually have the space and time to sit 1 day, 2 days, 5 days and say, what is that we're actually doing? Less about how we achieve, right? Less about the yang energy, do, and more about yin energy. How does it feel to be in this system? How are we taking care of ourselves and the others? I really care for people. So then when our practice becomes so fast, moving from intervention to intervention, from money to money, then the practice becomes dehumanizing. And that's a question for scaling up. It's very hard already to be compassionate towards this person that is right in front of me, because my ego gets in the way. What does it look like to be compassionate for 100 people, 1,000 people, 10,000 people, 100,000 people, 1,000,000 people? How do I keep in mind that these people actually are complex human beings whose behavior will change from day to day, whose action will change from day to day, who have desires, love, feelings, affections, emotions? And how do I avoid commodifying their numbers in order to finance the survival of my organization? So 4 quick metaphors just to present ourselves with some of the ethical challenges in global health. And it is our lovely panelists who will help us today with unraveling some of these challenges. Um, I will now say something very quickly. Of course, our panelists have done very much, and their bios are online. But I will just give you just a quick introduction to them. So Chloe, Dr. Chloe Schwenke is a development ethicist, researcher, academic, and international development practitioner. She currently serves as the president and founder of the nonprofit Center for Values in International Development. So thank you, Chloe, for being with us today. Diogo Moshkovic holds a PhD in philosophy, complemented by 2 postdoctoral fellowships, one in bioethics, applied ethics, and public health, and another one in medicine. And currently, he serves as researcher coordinator at the Canada Chair of Shared Decision Making and Knowledge Mobilization. Louise Agersnaps is a political scientist and change leader for global affairs in health development and the innovation ecosystem. She has worked with the United Nations, private sector, government, NGO, and academia for over 20 years. She currently leads the Innovation Hub at the World Health Organization. I will introduce Peter in case his connection makes it possible for him to join. Peter Wiseway is Associate Professor of Health Policy Planning and Management of the School of Public Health at Makerere Universities. And he studies health system implementation, research, and policy influence in reproductive health, maternal, newborn, and child health. And as for me, I've already been introduced. I work at I'm the firekeeper of the Humanizing Development Collective, and check the website. It's a very nascent institution. Okay, so thank you very much for bearing with me within this initial presentation. If our panelists are ready, maybe we could start with the first question. Maybe Chloe, if I could address this to you. So when scaling up health intervention, how do you think we can engage with and possibly find solutions to the tensions generated by the values and principles of different stakeholders, not only across donors, interveners, and communities, but also between people in the communities themselves? That is, what mechanism can we use to identify and reach consensus on the core values, and then use them as basis for evaluating a process and outcomes of interventions? I hope the question is clear. It's a long one, but I'd love to hear what you think. And I think you might be muted, Chloe. Sorry.
Yes, can you hear me now?
Yeah, loud and
Yes.
clear. Thanks.
Super. Okay. Thank you very much. That's a great introduction. I really appreciate that. I really like the perspectives you bring, because it helps us to think about this in different ways. The biggest challenge to the question that you're asking right now is that we're assuming that we can somehow find a consensus on values and ethical principles when I'll be so bold to say that we're not very good at it in the development space. We're not very conversant with the language, the vocabulary of moral values and ethical principles. It's not something we've been encouraged to cultivate a competency in. There's been a fairly widespread premise that people in development are people who are good people and people who care, and so that's enough. That's we'll talk about our maxims. We'll say do no harm. We'll say nothing about them without them, and that's as far as we go. What we find at the Center for Values is that the really deeper conversation about the space and meaning of values in decision making and in evaluation is largely lacking. And it's not just a problem of development, it's a broader societal problem right now. But I think the starting point really is to try to make the values explicit, understand a situation in a particular context, try to understand how to see the values. We do this as development ethicists through a tool we call values mapping. And values mapping is simply identifying the stakeholders that are involved in any particular situation or program or project and literally engage with them and find out how they themselves prioritize their values in a particular context. What we do through that process is identify, most importantly, places of alignment. We raise up values and help help that people to come to a consensus on the definition of those values, which is sometimes a piece of work. But soon, it's not impossible to find the places of alignment between those values, which we surface that vocabulary and help people to think it through. Um, the other key piece of that is find out where the conflicts are likely to be. People will raise values that are not aligned with other people's values and sometimes are directly in conflict with them. And being able to see that before we start real deliberations helps us to really anticipate and be prepared for those conflicts, but also how to build on those alignments. So that's the first piece of this. As we scale up, of course, it gets harder. Values mapping works great for small organizations and projects, but as you get more and more people involved, how many stakeholder groups can you engage with? It becomes really problematic. We move at that point to more of an inclusive development assessment process where it's largely formal qualitative research. It involves working groups, it involves focus groups, it involves connecting with people. It involves listening to people, hearing their narratives. That's really what we try to do, and building from those narratives a better sense of where people's stories are placing them. And that level of understanding as scale goes up really helps a lot. In some forms, it's called deliberative democracy. I don't think we have to go quite that far here, but I'll call it at least active listening and a commitment to each other. Last thing I would argue as an ethicist is that we need to have a starting point. And for us, the starting point is a shared commitment to recognize and respect universal, equal human dignity. I know that's a mouthful, but if everything depends on that, to recognize and respect equal, universal human dignity. I'll stop there. Thanks.
Thank you very much, Chloe. And I loved every single word of that. Thank you. Okay, maybe related to that, and maybe Louise, if I could maybe move to you with a as Chloe talked to us about the fascinating value mapping and really the challenges of doing that value mapping in larger groups, that presents us with a question of then how do we work as you scale up? And that's obviously a question of a process, but also a question of how, why, and whether it would be okay to move without value mapping across millions of people. And so the question maybe that I would like to invite you to answer is, what ethical questions do you think, similar to this one, what ethical questions are imperative for us to consider and for people to consider as they design scaling up intervention? That is, here we're thinking about how to take into account contextual factors, power relations, religious beliefs, collective cultural practice, but also on the one hand, you have the context that is very relative, and on this side, you have universal social justice goals, such as gender equality and human rights. So the question is, what ethical questions come to you that are important, and how answering those ethical questions can help stakeholders decide who will and should benefit from scaling up efforts? Thank you.
Well, thank you, Ben. I'll be pleased to speak to all of that. I think that a fundamental ethical question that we need to ask ourselves when we scale an innovation is, first of all, why and for whom are we scaling this innovation? And I'm saying this because I think for too long, the innovation ecosystem has been supply-driven and dominated by commercial market forces. Innovations have been pushed to populations rather than being pulled by them based on their needs. This has, of course, also been complemented by NGO-driven innovation projects that at least have been closer to public needs, but still have frequently not been implemented in a scalable or even a sustainable way. So we're far from the ideal scenario where innovations are developed for people and the systems where they are to be scaled, and then are scaled in response to what people need to thrive and survive as both implementers and beneficiaries of an innovation. So in my work in WHO, we're trying to change the scaling equation a bit to start with the question, what does the public sector prioritize in order to serve the needs of its population? And WHO can, we believe, play a catalytic role here because we have 194 member states and we are member states driven, and we have a presence on the ground in over 150 country offices. And we're actually embarking on a really exciting new chapter now, supported by Grand Challenges Canada, which is supporting us to test and prove this role of WHO being a catalyst for country demand in health innovation. We'll be working across sub-Saharan Africa and doing 6 innovation scaling projects where we will be looking at, first of all, starting with the country demands and priorities based on people needs, helping to facilitate the exploration of proven, mature, scaling-ready innovations, and then helping through a multi-stakeholder and through active listening, as per Chloe's point, adapting these innovations to the local context and the local needs, culture, etc., really in a very granular way. This is also done in collaboration with the International Development Innovation Alliance, IDIA, which is playing an active role as a catalyst for supply. So they're running and assessing those mature, scaling-ready innovations and identifying them and surfacing them, many of them from grassroots. So once we have the demand of a country has been established, there will be a range of ethical questions that we need to answer about. As mentioned here, contextual factors could be local power relations, the religious beliefs, collective cultural practices, some social justice goals, including gender equality and human rights. And lastly, I want to highlight that I think sustainability is a matter of ethics, because you don't want to be parachuting in innovations that are not connected to local needs and that are not sustainable, because it raises expectations and hopes, and then it falls flat on the ground potentially. So you've got to really think about sustainability out of respect for the people who are going to be users of this innovation. And to ensure sustainability, and just to learn on the lessons learned in public health from the last several decades, in WHO, in this scaling work, we're taking a primary healthcare approach to scaling innovation. And this is a new thing where we're combining the great guidance in the scaling space. Much of it has come from the WHO expanded guidance on innovation scale up, as well as good practices from the experts and practitioners globally. But this approach implies that we take integrated health services approach, that it's empowered by people and communities, and it's infused by multi-sectoral policy and action. So when we plan and measure this PhD-oriented approach, we look at all the critical factors around an innovation that will help sustain it, such as governance, the infrastructure, the health workforce, the level of access and availability. So this system approach, I believe, helps reinforce sustainability, and I think it's the ethical and right way to go. So I'll stop
Thank
there,
you.
but I hope that answers your question.
Well, it definitely does. The problem is that it raises many more questions. So let's see how many we can work with in this panel. Actually, your last point about innovation is a good is a very good one, and maybe Diogo and maybe Chloe, you will have something to say about that, because this is definitely a time in which, for better or worse, we're witnessing the importance of digital and mobile technologies. Sometimes I think in 5 years we'll out of a work because of AI, but of a job because of AI. But definitely digital and mobile technologies are becoming a condition for access to information and even livelihood opportunities. So, well, then also building on what Louisa said, maybe there is a question for you of how do you think we can ensure equitable access to these technologies, including AI, and whether we should, maybe is a question too, particularly for marginalized communities. What concerns would you have, for instance, regarding gender and equitable access to digital health technologies, and how should these be addressed? And maybe Diogo, you could give us a first attempt at the answer, and then Chloe another one, and then see where we get.
Okay. Oh, thank you, Ben. So, hello everyone. Thank you for having me here. It's a pleasure to discuss ethics with the scaling community. So, yeah, I think we have some related things here. Since Chloe told us and Luis as well, but because we have for the essential to understand for whom these technologies are designed and what is considered beneficial for that population. So I think it's better to understand this in a proper way. I think it's better to give an example and a scaling decision making for women health. Recently, our team has awarded a grant to conduct a research project in Global South in African countries, Cameroon and Senegal, and in South America as well, in Brazil. So I'm a Brazilian. I'm more comfortable to say about Brazil. So the team is led by my colleague Amedigo Govo, and I think he's in the chat. He's responsible for the project in all countries, and we have as well local leaders as Roberta. They were a mission at the Oswaldo Cruz Foundation, that's our partnership in Brazil, and it's located in Rio de Janeiro, near to several communities, and then the foundation is surrounded by many communities that they have a low human development index, and the scale implementation will take place at this foundation and the health center because it's strategic and close to the communities and the researchers. So I think for the point, the equitable access to digital and mobile health technologies, I think the problem, not a problem, but the questions has arisen in the mission. They were there, they went there because they want to create an app that serves a digital platform and then leveraging the scalability potential. But we have some issues. The first one, I think, was in the existing interventions at the health center and how professionals interact with women are already established in a paper-based communication. So the second point that we saw that some professionals have expressed concern that implementation digital platform could face a cultural resistance. And the third one is the technical constraints as internet. Although women have cell phones, many of those do not have internet access due to cheaper plans that limit data usage. So typically people rely on an open Wi-Fi networks, especially in this case in the health centers network infrastructure. So we have to have a better or increase the infrastructure to support the app used by all the patients. So I think the digital literacy is the crucial point in this situation, and to give equitable access to people. because especially in marginalized communities. Because the first level, as you to understand this, it's the internet access. The first point has we had to be a necessary and implement a network capable of meeting a higher demand than the current one, ensuring that everyone has internet access. In this case, the women that will implement the app. So after this, we don't have just increased the internet access, but I think we have to train the community leaders to give the basic notions of a digital literacy, because we know, everyone knows that we have the misinformation and the bad habits in mobile technology. So I think we can divide in 3 topics. Understand how to use the smartphone as a gadget in the first instance. The second one is how to use the apps, understand the digital information, how to manage this information on the cell phone. And the third one is the navigating the digital environment. So I think if we start with infrastructure is vital, but apps, for example, in a digital literacy, that I think it's the most important thing here, the apps should be lightweight and accessible, even for devices like cell phones and tablets in all types of technology, and the less expensive to most expensive. And I think it's probably more effective to provide some smartphones to people who don't have one, to try to decrease the inequalities. One possibility could be donated refurbished cell phones and did some partnership with companies, for example. But I think, to summarize all the things, is digital literacy in some main levels, not just give cell phones, but guarantee the infrastructure and how to manage the digital information. So with this, I think we have the beginning of equitable access. Thank you.
Thank you, Diogo. Thank you very much, and very practical and technical solutions that I jot them down all. Chloe, do you also want to chip in into this question?
I do. I appreciate what Diogo says. I think he's more optimistic than I am. I'm actually concerned that we're not talking about the big bear in the room, and to me that's patriarchy. We really have to understand that in so many countries in the global South, women's access to just about anything is controlled by men, and that's not going to change when it gets to terms of control of access to digital resources. We have some real serious work to do. A lot of my work is in gender-based violence and working in that space, and it's not getting better. It's absolutely not getting better. So when we're thinking about how do we expand digital access, we have to deal with some real structural problems of getting values into a space where we can really reflect and change them. And patriarchy is a big piece of that. So too is the role of men. Male engagement in overcoming gender-based violence, including technology-facilitated gender-based violence, has got to be that needs to be scaled up. I mean, if anything needs to be scaled up to really improve access for women, girls, and marginalized people generally, we've got to change some norms. We've got to do some serious norm changing, and that's only going to happen if men step up and really start to be part of the solution instead of the problem here. We also have a data problem, which no one's really yet spoken about. There's essentially a data desert in terms of AI in the global South. The data in large language models at that scale, again, a good scaling up issue, comes from the global North. And the platforms on which to analyze that data are all based in the global North. This is a huge increase in the asymmetries of development between global North and global South, and it's only getting worse at an exponential scale. So we have to get serious about what does AI mean for the global South. There's some important work being done, particularly by feminist groups in Africa, for instance, who are figuring this out for themselves, but it's going to take resources and significant amount of resources. It's going to take a recognition that global North cannot just go in and harvest data. Data has meaning and significance that's contextualized and needs to be owned by the people whose data it is and interpreted by them first and foremost. So the data issue is sticky. We really need to really focus on, across the digital space, across the AI space, who owns the data, who gets to interpret it, and what it means. So I would, I'm not entirely negative or cynical, but I think we've got serious work to do about expanding the range of participation in a meaningful way. It's going to take, actually, a really good piece of this is investing in civil society. We keep talking about that, but if we're talking about scaling up, we're not going to get, accessible, really functional mechanisms, digital access mechanisms, smartphones, whatever, to enough people to change right away. We have to resort to civil society and invest in them to create the safe spaces where marginalized people, women and girls, can go to connect without being hassled. We also have to do a lot more for safety online. Women are being so badly treated online right now, not just in the global south, but we've got some, again, serious work to do. And I'm looking at men in particular because they're not really being part of the solution yet. They need to be. I'll stop there.
Thank you both. And actually, this raises, I am really fascinated and following the conversation, and this also raises question of how do we, that maybe we can talk about later, but how do we engage men in a meaningful way at all different levels, not just the community level, but across the whole ecology of intervention. And this also, maybe Louise, something that you may want to comment on, but as we talk about, Chloe just reminded us of the importance of making sure that gender equality is not framed as a fight, but that there is an understanding that actually patriarchy is oppressive for people of all gender, including men themselves, and then we engage them into positive transformation, societal and social transformation. There's hoping. Maybe the question is, there's a broader question about what ethical principle you think should frame the design of health intervention, particularly when we think about the scaling up of those health interventions. So we have a great intervention, it's fantastic, it's working in this one area, we're thinking about scaling up. Well, what ethical principles should be taken into account? Specifically, what we're thinking about here is whether or how this intervention should be proven to be effective, should be proven to be context appropriate, should be including to be duplicative, accessible, sustainable, equitable, and there is a plethora of words there, and maybe not, maybe they shouldn't be. Any comments or ideas? And I see Peter is actually also online. Hi, Peter. So maybe Louise, maybe you could comment that, and then if Peter is able to connect, he could say something about it too.
Absolutely. And let me first just reflect on Chloe's great points, because it does take, I think, an active role of men in changing the gender equality. The burden is not on women to try to fight for a space or wait to be empowered, as if we're passively sitting there waiting for that to happen. So I've seen some really interesting steps taken recently, including by an innovation colleague and friend of mine, Christian Basin, and I wrote about this on LinkedIn, who announced publicly from now on he will boycott invitations to male-only panels, male-only boards, and simply send a signal that it's not acceptable. And I think that kind of integrity and walking the talk is what we need. So we can wait for systems to improve, etc. We must remember that the systems are created by us. The more that we sort of just go with the flow and accept, oh, the system is flawed, nothing's going to change. So each individual has a role to play, I believe. But just turning more specifically to your question, in terms of principles for building a scaling strategy, again, I'm turning to the WHO Expanded Guidance, which I think it's based on so much research and practice and evidence that there's no need to reinvent the wheel here. It talks about, there's one publication called 9 Steps for Developing a Scale-Up Strategy, and Laura kindly put links to it in the chat. But this provides, in my view, an ethics-infused and very practical approach to this. And the first principle is systems thinking. I already spoke about it, but I think we cannot talk sustainability and sort of an ethical approach without seeing an innovation in the context. So we got to be aware of that an expansion and institutionalization of an innovation occurs in a context, in a complex network of interactions, which should be taken into account in order to ensure a success of the scale-up project. And in this framework, systems thinking refers specifically to relationships between all the stakeholders, the innovation, the user organization, the resource team, and the larger environment within which that scaling practice takes place. So change in one element will affect the other, and we got to understand those dynamics. And when we strive for, good relationships or balance between these elements, that's a major task when we design and implement a strategy. The second principle is to focus on sustainability. So really looking at a sustainable policy and program development around that innovation, paying attention to institutionalizing the innovation in policies, programs, guidelines, budgets, other dimensions of the health system when we roll out an innovation. So again, systems approaches I find are extremely important without losing ourselves in it. It sounds very complex, etc., but it's really thinking through the wider context that will, in the end, enable an innovation to take root and thrive and survive. A third principle I want to mention is scalability. So we want to enhance scalability as we scale and develop a plan for scaling and innovation. This is about the ease or difficulty of scaling up an innovation based on different determinants that we have found as we do research on the innovation. And lastly, and very much in reference to your points, Ben and Chloe, we need to maintain a focus on respect for human rights, equity, and gender perspectives. So a scale-up strategy must be grounded in these principles, human rights, and be guided by participatory and client-centered approaches. Chloe mentioned listening. I would add empathy. It should ensure attention to human dignity, the needs and rights of vulnerable groups, and gender perspectives, as well as access to quality services. And I just want to give an example of this. That some innovations, they can help relieve unequal burdens on women from their work responsibilities. For instance, of provision of deep wells in villages or fuel-efficient stoves that will free up women's and girls' time so they don't have to walk long distances to collect wood and often be at the risk of rape or attack as they do that. But on the other hand, there may be other innovations that could inadvertently decrease equitable impacts on women. For instance, when you have all male community health worker networks, or when you entrust certain community leaders who then turn out not to really represent the diversity of the community with decision making and the provision of input into human-centric design or other aspects of community involvement. And also I want to highlight in the space of sexual and reproductive health and rights, we must be constantly on the alert for unintended consequences of introducing new innovations. And gender equity needs to be a key focus. Thank you.
Thank you, Louise. Yeah, and I sense this is very helpful. I do. By the way, sorry, a technical question. Speaking of technical, I saw Peter coming up and then he disappeared again. So Peter, if you're there, can you move the Ouija board?
Yeah.
You are?
Hello.
Okay.
Can you hear me?
Yes.
Here,
Okay,
yeah.
fantastic. Sorry, it's just because I couldn't see your name all of a sudden. So yeah, thank you. And Peter, I'm not sure you were here when I asked the question to Louise, but if you are, or if you could follow what the question was, you're more than welcome to chip in as well, or you want me maybe to repeat it again. What would be helpful? You've been
Please
introduced
repeat the
already.
question. Please repeat the question. Thank you.
Yeah, okay. Thank you, Peter. And by the way, we have already introduced you to the audience, so thank you for joining. We were just talking about what ethical principles should frame the design of a health intervention, you think, in terms of being context appropriate, not duplicative, accessible, sustainable, and so on. Thank you, Peter. Please yeah.
No, thank you so much for this, and the apologies for my camera, but also internet, as often happens in low and middle income countries. Sometimes things are not the best. But scale up is indeed very important. And without scale up, actually, you cannot have impact. Let me start from the beginning and say, I always say that impact is equal to coverage times quality times equity. So in the scale up, if you don't have high coverage and you don't also have quality and you don't reach the most marginalized, then there is no impact. So intervention, and of course, this also goes together with the issue of sustainability. So there are several things. I think some of them perhaps you've discussed. One of the critical things is, and I think Lois has brought up these issues. Understanding the context is so important in which scale up is going to happen, including issues of the culture of the place, power relations, culture sensitivity, so that you are respectful. For instance, right now we actually are doing a project. I'm in Uganda, and we're doing a project in a place which is both Muslims and Christians, and then other people who don't really care what happens. And these groups, their interests are different. If you go to the Catholics and promote family planning without engaging them, then it's going to be problematic, but also how you promote it in other groups. So cultural sensitivity becomes important. Also, if you go to a place and look at issues like, let's say family planning is one of the good things that many people come, they want to reduce the number of children. And you go to a community where people have been losing so many children. The way you bring up the message needs to be perhaps different. Like you say, if a mother was able to space, then it is good for the mother, but also it's good for the child and it's good for the community. Then you'll be sensitive to issues of not just focusing on, let's say, bringing what they might consider as Western values. So many times when we've done these programs like family planning and stuff, and without co-creation, without consultation, without a human-centered design, we've ended up with a lot of rejection. And right now I've been completing a project, actually several projects, one funded by the Gates Foundation and another project. And we use the human-centered design. There we were able to understand the needs of communities and then respect them, but also change the way we deliver the program. And we realized that we need to bring in other people who are elders. They may not be the former people we use as health workers or community health workers, but there might be other people of influence. You may also have to go and speak to a cultural leader or somebody who is influential in the community. And these days we have younger people, they're actually breaking away from all the old things in the community. So if you try to do an intervention and you have one size fits all without engaging these younger people to understand what are their interests, then they will not take the intervention. So understanding the context, the culture, the practices, religious issues becomes important. And therefore community engagement and the way it is done becomes very important. So especially in poor communities, we always think because they are poor, they need an intervention, but also they have rights. They need to be consulted. They need to consent. And how do you get community consent? I remember one time we were taking a project to a district where there was the district leader, a woman, somebody who is a former member of parliament in Uganda. She's the former head of programs at the Red Cross. She's trained as a social scientist from London and said, we are not going to accept your intervention here. We were shocked. How could a local leader who is that educated refuse? And what she told me was, well, the problem with you people, you want to do birth preparedness here, you want to use community workers. No, we don't want this. This is how government gives us a lower level intervention. Let them invest in community health workers, but also at the same time, build for us a hospital. So in this community, they felt that the government had neglected them, and now we are taking to them an intervention which is of lower level. So understanding the community dynamics becomes very important, and you need to be transparent and you need to be accountable. These are some of the issues that are critical when designing an intervention. And maybe later when you allow, one of the things that perhaps when we reach there, which I could discuss, is the fact that I said that the intervention has to be effective and impactful becomes an important part. And so in the design, that is so important that communities are involved, not just consulted, but also perhaps in designing, and the intervention could perhaps be modified to suit the local context. This is something I've written about. I called it institutionalization of projects into district systems. What does it take? And one of the key messages is understanding the context, co-creation, having champions, and being flexible as you design, and have a listening ear. Thank you so much.
Thank you, Peter. I can notice that something in my body started to shake. My nervous system is getting a bit activated, and I can't quite put my finger on it, but I think, and maybe there's a follow-up question in that. To me, ethics is in the body, not in the brain. I was a professor of ethics, and so this is why I'm bringing my nervous system. So that is something that is, and I think that in a way, I wonder, and I would like to then send back a question again to all our panelists, because everything we're saying is actually beautiful and rational, but there are two things that are not quite coming. I think on the one hand, we have this beautiful, right, set of principles and that are served to on a beautiful plate, right? They need to be efficient, equitable, sustainable. And again, it seems to me that we're actually not getting to, I mean, they're all correct things. And I think, yeah, but community-led, I'm a big proponent of community-led development, so don't take this wrong, but community-led development is something that has been going on for many years, and human-centered development, and yet, when we stop and look, we still have interventions that, Peter, you said something that touched me so deeply. I was really moved when you said, well, you cannot say that's the same message in the same two villages, because here, maybe the mothers have lost a lot of children. And yet there is no time to do that. So maybe moving a little bit to imagination, we're saying all these beautiful things, and yet they're not happening. What needs to change in the design and creation of an intervention that actually allows us to treat people as humans, that the dignity that Chloe spoke and reminded us of, right? Because in a way, it's almost feel that then we can go home and all pat our shoulders because we mentioned all the right things. But at the end of the day, still there is something in blood and flesh in those villages, in those cities, in those houses, wherever they are. So what needs to change for global health to become able of recognizing that human dignity and actually, in fact, see people look at people in the eyes, right? I don't know if the question, and it's a question for you, Peter, but also Chloe, Diogo, Luis, the whole panel.
Yeah, what needs to change? And actually, maybe you could look at it this way. Ever wondered why most programs don't have impact? And you know that most of them don't have impact, even when they are so-called evidence-based. Because many times when we are looking at evidence, we are being theoretical. We are like looking, this thing of evidence comes from medicines and stuff like that, and randomized trials, which we do in test tubes. But so when we talk about evidence, many times, and it's true, we should use evidence, which is basically from tested stuff or from experts. But going beyond the evidence has to interact with the local context. And so many times, unfortunately, we transfer the intervention from the science to maybe a global community, to elites. And we are part of the problem. We forget that even elites in developing countries are part of that extension of a system which needs to be decolonized. So I wrote a paper called "We also need to self-decolonize." So one of the things for me, I always tell colleagues that although I come from Uganda and from a village, there are so many people who know my village more than me because I no longer live in it. So the fact that we cannot just import expertise or get it from the capital to the countryside is so important, especially when designing intervention that are behavior change. And that means that we must sit back a little bit with our expertise and be able to work with local people in that co-designing or redesigning and also implementing. So that's the one part, get people on board as part of the implementation. Two, we need to build the expertise that is local, not just local meaning that they are Ugandan, but also Ugandans who are local in that context. Because even when you get another Ugandan and you take them to a village, people will look at that person as from a different place. So that's important. The other one is feedback. As we implement, we must have a way of listening to what people say and embed it in implementation. I think for me, those are two important messages that I would like to say, that when we are measuring, doing process evaluation, we should also have the voices of the people as we implement. That is so, for me, critical in implementing. I think those for me are the two most important things that would say, even when you use local elites, they also need to know that they beat outsiders in most of the communities where the work happens, and they need to of local. Thank you.
Thank you, Peter. Sorry, I didn't mean to cut you off. Sorry, there was a bit of a delay on my side. Thank you, Peter. I wonder if very powerful. I wonder if Chloe, Diogo, Luis, you would also like to chip in into this at all, or?
I think Peter's done a great job. I don't have anything to add. I really, really liked what he had to say.
Thank you, Chloe. Luis, Diogo, I see Luis, you raised your hand.
I can chip in very briefly. I think these were great points already. I think it's important to keep in mind that we're in it together, that this is not us coming to them and they being the underserved and so on. We've all tried, of course, in different degrees to know what it means to not have adequate access or be underserved or not feeling that we're being seen as a whole human being by the health system, that it's fragmented, etc. So that empathy with where they are, even though that it's maybe a much different and much worse, certainly, situation that others are in. Let's try to solve a little bit this us-them dichotomy and try to be in it together. We're trying really as the WHO Innovation Hub also to think about our different work areas as more as a co-creation space. For instance, when we gauge on what we would traditionally call capacity building, we're changing it to say that this is collaborative learning, because we also have a lot to learn about what we think might work in the beautiful guidance that I have referred to today, which I think gets a lot of it right. But still, as we use it with others, let's have a fresh look at it and hear if it actually makes sense to our colleagues in Ethiopia or Brazil. So just being in it together, having that mindset, I think might get us a long way.
Thank you, Luis. And Diogo, without giving us a master class on Foucault, even though just because we are near the end, but do you have any comments on that, or would you rather move to maybe a last question or people's questions?
So, okay, everyone hear me? Is it okay?
Yeah.
So, I would like actually just bring some research points to this in an ethical and philosophical perspective here. So, in this follow-up question to build governance, I think I'm 100% agree with all the panelists. And some work we did on our share is to understand and make explicit all the ethical inspirations that we have in some guidelines and papers, etc. Because we talk about ethics, but we have a point of view for philosophy and the ethical, which we decide in each stage of scaling and intervention. We have, I would like to say, a moral calculation. We are just in balancing the choices to advance or to stop. And then we started to do, and I just pick one example that we worked together, Roberta Coroa and me and all the team in the chair. You conduct a systematic review. She's led by my colleague Roberta Coroa, and we developed some guidelines and some guides to understand what is the split, to make explicit what is the ethical inspirations in all frameworks that we found on the literature and the great literature. And then we try to make this explicit, and this is the focus on the patients. So, and the patient's involvement. And I think it's aligned to what everyone said, especially Peter, that we have to conduct and understand why we are scaling the innovations. So I think the first point, as everyone said, is understand who is the community that will be engaged in that innovation, and then we can explicit this and try to create a governance of red flags and ethical red flags. What we discovered when we conducted this systematic review, that we have some principles, especially in utilitarian principles. We have some must do, like deontological and Dutch and right, because it's our people have rights to receive, or as a stakeholders we have to do this and implement the intervention. So if we have some ethical inspirations more in the frameworks and guidelines, we can be more ethical sensitive to understand and intervene and say, hello, it's a red flag because this community, as Peter said, for example, it's sensitive for this subject. So I think it's in our role as a researchers, it's to make explicit what is the ethical inspirations and moral concerns in each framework, to express this and try to make it in a practical way.
Thank you, Diogo. Thank you very much. I will now ask one last question, but so just alerting our participants that if you have any questions for a panelist, please start to think them and maybe write them in the chat. There will be maybe time for one or two questions, no more. But just before we start with the audience's question, I would like to just to have a last twist, maybe for Chloe, and maybe Diogo, if you have to also provide an idea on that, on whether AI can ensure the respect of ethical principles, and what are the challenges that using AI in health intervention can pose to ethics, equity, social justice, and human rights, and what should the different stakeholders do? Maybe Chloe, you could give us your insights first, and then Diogo.
Sure, happy to do so. This is an area we do a lot of work in, largely because very few people are doing work in this space, which we should be concerned about. Most of the focus on AI is on machine learning and the data that goes into that learning. There's a whole nother field of AI called machine ethics. And that's really about the answer to the question you just raised. How do we get AI to think ethically? First of all, we have to realize AI does not think. AI associates patterns. AI has no moral judgment whatsoever. So if we're just assuming that AI is going to find a moral answer, it's not going to happen unless we actually write the algorithms that gets it to think in a particular context that around what the moral concerns ought to be how they should be looked at. That's the work we have to do, is to help work with data scientists to write those algorithms. And we have so many tools available as ethicists, not only the utilitarian thinking, and Diogo just mentioned some of those. I mean, we have ethics of care, which goes back to Luisa's concerns. We have Kant, we have all kinds of people, Rawls, we have all kinds of Aristotle. We have wonderful ethical frameworks that are sophisticated, that can help us find the questions to interrogate the context, the situation, so that AI can be ethical, at least can be more ethical than it is right now. If we do nothing, if we simply use machine learning, it's going to pick up all of the biases that are in the data already. And most of the biases are not what we want. I mean, seriously, there's some very serious misconceptions about human nature in these massive machine, large language models. We have to be able to actually filter that out, and that takes knowledge of ethics itself. So we have a lot of work to do there in that sense right away. Just a quick example, we worked with a data sciences firm called Developmetrics, wonderful women-owned organization, to interrogate the Development Experience Clearinghouse, the DEC at USAID. That's over 470,000 documents in the last 70 years since it started. We wanted to find one simple question. Has any of USAID's 7 core values that they list and define quite robustly, are they showing up in project reports? Are they showing up in the documentation around projects? The highest, and this a lot of this, the biggest area of expenditure in USAID is health. The largest percentage in any of those years where any of those values showed up was 2%. So much for core values. We have so much work to do to elevate core values and then to build those in intentionally into AI through machine ethics.
Thank you so much, Chloe. I'll be a little bit desponding towards the end, but thank you. Diogo, do you also want to chip in maybe towards the end of our session on this?
Yeah, sure. So I'd like to thank you, Chloe, for mentioning all the kinds of ethics, because it's interesting. As a researcher, I found mostly utilitarian, deontological, but I know ethics of care is really important for us to give the characteristics, and I think it's super aligned to, for example, the cultural sensitive. Just a parenthesis, and then for about the AI. So yeah, I'm 100% with Chloe. The AI doesn't think at all. It's just a reproduction of patterns and the algorithm that the data came from us. So it's a little bit funny that thinking about AI as something detached from us, because it's a product of a human beings. So but just to be practical, I think, okay, the problem is that as we said, discriminatory biases because of it, the data. So they can promote, unfortunately, the inequitable outcomes and biases in treatment decisions, because if you're just a kind of machine learning from a data from, I don't know, for a country, for just an example, we have a problem if we will generalize an application, for example. So, and I think in the most practical and objective sense, it's the privacy concerns. I think privacy concerns is the most important thing if we can understand the human rights and all the principles we have here, because maybe inadequate privacy protections in AI-driven and health intervention especially can result in unauthorized access to sensitive data, health data. And maybe that's the risks that if I can point it out. And I think that to overcome the problem of trust, we can start it with promoting the data transparency. That's something important, because infotech companies normally do it to trade the secrets and the intellectual properties, and then they tend to close their systems and they close their algorithms and prevent the competitors from gaining access and sharing the information. So I think that's a problem, but we can try to objectively create a governance with a model that can access how AI work, because with certain decisions were made when we just, for example, we are looking to the app and we are looking at and why this decision I made, but we have so many codes behind that position in that app. So we have to understand what all of this. So just to be more clear, I think about the stakeholders, I can enumerate, I can list some big players. I think because AI is like mobile health technologies, the big thing right now in nowadays. The government can develop and enforce these regulations and AI in healthcare and try to bridge the gap between companies, like I said, the problem in intellectual properties and developers, information, AI creation. But I think infotech companies has a big responsibility because first we have all the EDI, the inclusion for people from the beginning until the promoting the app. It's important big from the beginning, the development beginning to we have people involved. For example, in our chair, we involved the patient partners and citizen partners to try to disseminate the research and give them, because we work for the society. So we had to translate our information, research information. And I think it's the same for AI and the infotech companies, because they have to get to contract the people, the team, to try to incorporate them in our in their development in the apps, for example, or algorithms. But I think all of the gender sensitive, all the questions here we have as well in the infotech companies getting the interdisciplinary team, because it's not possible, as Chloe said, we have just developers like a white man doing the codes, but we have to the diversity, because normally it's the white man doing the code. So but not just this, but we have to not engineers and data scientists, but we have to philosophers, sociologists, artists involved in the creation, because that it's important for us to understand as a society. How can we understand a global application or algorithm, because we're dealing with some big algorithms. So just to finish, researcher, I think, is just the bridge between these big players, trying to consider and pointing the ethical points or gaps, as I said before. And NGO, I think, can be a partner or a beta tester between a great scaling of an application or an algorithm. It can be a partner with healthcare professionals and healthcare providers, and could provide some feedback. But just a moment, but last but not least, just the individuals, the impacted people, because they are the most concerned here. It's like the individuals that have been included from the beginning until the end, and given the feedbacks from the developers, the interdisciplinary team, NGOs, research, etc. So now I think, thank you.
Thank you, Diogo. Thank you. Sorry, just mindful of the time. We're 60 seconds from the end. I would like to thank all participants. I know there were a couple of things that we still wanted to say, but I'm also aware that we committed until the half an hour. So I would like to thank all participants in the panel. Thank you, Chloe. Thank you, Diogo. Thank you, Louise, and thank you, Peter. It was an incredibly interesting conversation. I know we just scratched the surface. Something else that I would have loved to talk to you about is whether AI can be ethical, because if a being without a body can be ethical. That's something that I would love to talk about. We talked about dignity and the importance of seeing people as they are, and I don't think that we completely yet finished talking about how living in a system of exploitation and violence, with a system of incentives that push us towards violence and exploitation, can actually allow us in a space of tension to be human across these large numbers. But I feel that we had a direction. I feel that there were a lot of comments in the chat. So thank you so much. The recording will be available. I am very honored that I was able to stand in the front of these 4 fantastic luminaries and practitioners and activists. And I thank everyone for organizing this. Thank you very much.